Welcome to October and episode number 13. Lucky number, right? Well, today is going to be a little bit different in the sense that I'm going to recap, I think, the second video we did, titled Second Chances. And the reason for it is I wanted to do kind of what happens after the procedure. Like, what did recovery look like? What, did it heal? What does the patient have to say? And because of that, I had to get a little creative on how to capture it. My patient was a little bit shy, very informative, very much wanted to participate. So we agreed on doing sort of interview style audio narrative. And so I'm going to play this audio along the way, and I'm going to then add the images that can sort of help complement the story. So you're going to hear me ask her questions, and she's going to respond. And I want you to really pay attention to what she says, because this is actually a long story. In fact, her memory was pretty good. I went and dove into her records and tracked everything down that I could, all the way back to the old paper system. In fact, the first record I have in this lower right-hand quadrant actually was in 1998. She was a little bit off on that date. But I'll correct things and I'll add the dates as we go on. But I want you to listen to her story. This is a very, very powerful story. And it's a story that we've been judged by as endodontists since the beginning of endodontics. We're going to actually just tell the story from her perspective and add the images as necessary. And I want you to really pay attention to what transpired here. It's very fascinating and very, very insightful. And hopefully we all can grow from this. And I know she did. And it's just the raw, honest truth of what it is, and including the experience that you guys witnessed. So if you want all the details of how the case was treated, you just go back to the second video called Second Chances, and you can watch. And I threw in some little things here. So enough of that. Let's get started. So like I said, we're going to start with a narration of this interview process. And I'm listening to her in my ear, which is why this is here. And then I'll be able to fill in as necessary. So, okay. Let's switch screens here, and I'm going to hit play, and she's going to come on, and like I said, you're going to hear our narrative. All right, let's begin. All right, Stephanie, so when was your first root canal on that 231?
Probably between 2000 and 2001.
1999. Okay, so right at 2000s.
Yeah.
And that was an initial root canal.
That was
Do you remember why? Was it a pulpitis or was it a necrosis?
I was getting headaches and jaw pain, but there was I don't remember what they said.
Okay. So to your knowledge, though, it wasn't like they showed you an abscess on the bone. And we'll go back and look at that x-ray to confirm. So you had symptomatic symptoms, and endodontist diagnosed it as needing a root canal, correct?
Yeah, and pressure, cold and hot sensitivity.
Okay, so it's a pulpitis. So, okay, that makes sense. So it's basically a pulpitis tooth. You had it treated, and then what was it like?
The visit was fine, just normal tenderness afterwards.
So, but some post-op sensitivity that just went away?
Yes.
So percussion sensitivity, biting, whatever. And then did you immediately get a crown put on it, or?
Probably within the next 3 months.
So you got your crown, life went on. And then how much time went by before it acted up again?
A little bit less than a year. They ended up going back into it and retreating it because they thought maybe they missed a canal.
So did they use a microscope? Did they use a cone beam?
Or the doctor didn't have cone beams at that time. Let's see, I'm not really sure if he used a microscope or not. I don't think so.
Okay. So it just was kind of going back in a little bit blind, and it was chasing more symptoms?
Yes.
What were those symptoms? So this was like, let's say if the first one was 2000 for talking points, this would be like 2001 and a half. So we're about
Exactly.
a year and a half.
Yeah.
So
I think it was about a year.
So what were the symptoms for the retreatment?
Percussion sensitivity, headache, and that was what they attributed it to.
Okay.
Was that tooth.
And did they check your bite?
They did. That was done a couple times and with no relief.
Okay. So they did a couple checks, follow-ups. You kept coming back in because it just never really quite settled down. Something was going on, headaches. So now they go round 2.
Mm-hmm.
Did they tell you anything on round 2? Did they find anything, or did they?
Not that I'm aware of. I think they said they just went down. They didn't go as far down the canal as they thought they should have. I think that was what they told me, if I remember correctly.
That's fair.
Yeah.
So they thought something was left behind, go a little further.
Yes.
Did it again. Okay, then what happened?
Probably about a year and a half.
So
later.
Symptoms, did they give you antibiotics? Did it help?
It did help for a little while. I did have antibiotics, and I think I did have antibiotics again. And then they ended up doing a root canal on tooth number 30, which is the one right in front of it, apparently. And
so that was after the retreatment.
Mm-hmm.
So you still had the same sort of symptoms, and then they thought maybe it was another tooth.
Exactly.
And then you went to...
And had the other tooth done. After that...
How much time from the retreatment to that other tooth?
Within 6 months.
Okay.
Yeah.
Okay.
Yeah. And then I think about a year after that is when I came back in, and it was still very tender to biting. They had taken it completely where I wasn't biting on the tooth any longer. But it's just still hurt.
Both teeth or just the back tooth?
Just the back tooth.
So you had 30 done, and then it apparently felt stable. Mm-hmm. So then they took 31 out of occlusion. Mm-hmm. That's after a retreatment on 31, treatment on 30. Mm-hmm. They take 31 out of occlusion and just kind of made you kind of forget about it.
Pretty much.
Okay.
Yeah.
And then, so now we're out almost 3 years?
Yes.
For that story.
Exactly.
Okay. And then what was the next?
I went and I saw the doctor because I was still, even though they'd taken that out, now it was like moved over. It kind of felt like a little bit.
Like it started moving?
Yeah. And it was making my whole jaw hurt rather than just on the bottom. And he put me on antibiotics and then said he wanted to do a surgery on both teeth.
Why both?
He just said since they were both root canal, he said he wanted to do it. He said he saw something on the x-ray that said that he needed to do both.
So this is still 3 years?
This was later 2003.
Okay. Okay. So, and then he did Apicos.
Yes.
And do you remember how was that experience?
I don't remember it because I went to sleep.
Okay.
I did not want to be awake for that. Afterwards was like night and day. I didn't have any more pain. I did have some numbness on there for about 6 months, but they said that was normal because it did eventually come back. Other than that, I mean, it was a good long while before I started feeling different sensations that weren't normal, and it was probably about 10 years later.
So, okay, so then you go through the surgery, and apparently that was the smoking gun. Like, it just, everything felt better after the recovery. Granted, you were numb for 6 months, and then the paresthesia went away, started coming back, but you're feeling great.
I was feeling fine.
Fully functioning. So, from basically, is it fair to say year 4, you were like back to normal? But it was but it was a 4-year journey.
For sure.
All right, a 4-year journey to get to this point. Now, this is where it gets kind of interesting because from her narrative, from her mind, she skipped everything else up until she saw me. Like, she just didn't remember. She was actually really accurate. I kind of made some gestures of some time frames. I mean, I've got her report here, and so I'm going to read you some things. Back in 1998, her chief complaint was biting pressure, achiness after eating, and jaw pain. And you heard her describe that. That was the initial root canal. And then it just kind of grew. It just never got better. They went to adjacent tooth, started with one, it grew to another. And then it goes all the way with sort of these excuses, these modifications, checking bites, those sorts of things. And it goes all the way up to a retreatment. And then Apico in 2003. And then from there, she kind of reported, yeah, it was great for like 10 years. But when you look at her record, she actually came in just January 30th, 08. And what she said there was almost very similar. She said, hey, you know what? I still got biting pain, jaw tenderness, and it shoots to my ear. And they didn't quite know what to do. There were some minor meds. Some Bedroll dose pack was prescribed, and then a modification to the bite. And didn't really perceive much because these x-rays, compared to the previous ones, actually showed some sort of healing or some resolution going on, certainly around this one. This might be a little bit debatable. No cone beam at the time in the practice, and they just kind of bought more time. They said, you know what, if this fixes it, that's great. And antibiotics were also prescribed. And then, if we go a little bit further in, let's advance now to 415. So it was roughly 3 months. And she reports again, you know what, the tooth just doesn't feel right. It still aches. And there's just sort of this on and off, like good days, bad days. It's kind of a moody tooth. It's just a little bit grouchy, but to no avail. So they did the same strategy again. They're like, well, we'll watch it. There's no localized swelling. Probings were fine. They just didn't really know. They knew there was this history of paresthesia, so maybe there was some allodynia type scenarios going on. They really didn't know, and so she kind of just thought maybe it was in her head, even though it wasn't terribly painful. She wasn't taking narcotics or things like that, but she just wasn't comfortable and just started focusing and chewing on the other side. And then what happened, she started breaking teeth on the other side. And what we didn't get out of this story until a little bit of homework is she started going through implant scenarios and implant failure scenarios. So this poor patient has just been through everything. All right, so let's go one step further and see what else happens in her record. Okay, so then she kind of goes through the implant story, and you read the narratives, and now we're up to 08, 12/9/08, and she's like, it's just not getting better. All the problems that were happening when she shifted sides and favoring her left side now brought her back to the right side with these implant failures. And now she's like, dang it, man, this back tooth, it was starting to be more both. It was non-specific, but, we're in the notes, they started notating this 31 tooth. And they thought, you know what, maybe there's something there. And they talked about future treatment. And she'd been through too much, and she's like, okay, I'll go home and think about it. Went on another round of antibiotic and apparently started feeling better again, and then kind of just left. And so let's fast forward until we get to the next episode. A year later, she comes back, and it was interesting at the time, same symptoms, biting, pressure, and achiness after eating, nothing new. But nothing seemed to be, nothing changed, nothing grew from that last x-ray until this one. And so they got a little more confident again. They thought, well, God, maybe it's sort of atypical facial pain. I mean, they're just sort of reaching to explain. And she seemed reasonable. She seemed compliant. And I had to tell you, she's a fantastic patient after having worked with her. And so it was one of those things that was brushed under the rug yet again. So let's fast forward again. And now it's 2011, and look at that. Not much changing to the pre-apical structures. Very similar, seems stable. The big surgery side, this apical seems stable. But the darn crown fell off. And that posed some concerns for everybody. And then it came in, do they retreat it? Do they continue? Do they just have the dentist put a new crown on? Because she actually came back to the endodontist, not the dentist, when that came off. And so there's a little bit of dialogue, a little bit of a discussion on the phone, and on the phone with the referring doctor, with the dentist. And it was sort of decided to go back and just get a new crown made. And that's what was done. And we went a little bit fast, but kind of went smooth sailing from that 2011 point, and now it's 7/1/13, and the demons are back. She is really getting some tenderness now, and there wasn't any identifiable swelling. Again, for some reason, the periapical structures look maybe even a little bit better on these 2D x-rays, and they were kind of at odds. They're like, well, started another round of antibiotic and told her that maybe the tooth needed to come out. And she argued that in her record. She says, no, I'm not going to have these tooth out. Not yet. Because I'm still recovering from a second gen failed implant. And they don't work with me. My bone does not like implants. They don't like apparently root canals. I'm just a bad patient. And tears were had, and that was that. It was the end of that story. And so more time went on. In fact, there was a big gap. I mean, that was it. That was it in the notes. And again, she was so kind to let me share this story with you because of what transpired. So we go from 13 to 19, and this was kind of where her narrative picked up, right? So in the interview process I had, all that story was gone. She forgot about it. It was not in her record. It was not in her dialogue to me. And it wasn't until she went and gathered her records and we had a second dialogue, which was not recorded, that kind of got all this extra insight. So now we're going to talk at this point in time. So this is now what we saw. This is what brought her to the Dental Learning Live experience. And we're going to hear their narrative now of what. Here we go. When you came in. So when you came in, was it the same? Was that what clued you in because you were aware of that?
A little bit, just because when I start getting headaches or that lingering pain down the side of my jaw into my temple, I'm like, uh-oh. It was that same type of pain again. Not as bad, but I knew I don't want to go through that again. I want something's got to be done, either have the tooth taken out or, find out what's going on.
Yeah. And so when we worked on you, we only addressed 31.
That is
Remember,
correct.
30 had that surgery, and we said it was still asymptomatic. And so we didn't chase that. But you were aware of your experience, kind of taught you were clued in to what that kind of pain found out. So what made you trust us over, like, say, another surgery? Like, what was just as a patient, because when you think about it, it was only the surgery from your perspective that worked.
Yes.
So what made it possible for us to talk to you through another retreatment?
Probably because of what you showed me. I've never had a CT scan before. And from what you showed me on that, where the difference where you showed me where you could actually fix it with the instruments that you had and the technology that you had, I was willing to try it because I don't want to lose my tooth. And using the GentleWave as that's what you called your technology, or the technology that you had, it was great.
And
I didn't hardly have, it was great.
And did you want to be put back to sleep again?
No.
Okay. Were you nervous coming into it?
A little bit, just because I was worried that you were going to tell me I needed to have my tooth taken out. And I didn't want a tooth extraction.
So you can see now, we kind of just jump into that surgery. These are excerpts just from the procedure itself. And again, I'll remind you, you can go back to the second episode and watch it in completion if you're just watching this one today. It was actually quite stressful, this case. You didn't quite knew what I was getting into. My diet, the hindsight's 2020. I'm giving you sort of hindsight. I'm giving you the complete story. But at the time, I didn't have all those details. And I just knew, and I knew from the original cone beam that there was apicos done on both. And what I gathered from it, a retrofill was not able to be placed on 31, whereas it was placed on 30. And back in the time, the endodontist at the time actually practiced a really steep high bevel. And but again, the retrofill on 31, I think it was placed with super EVA actually, was intact, and nothing on this. And as you kind of glance through, I skipped over a lot of the details. I just wanted to show that I paid very careful attention not to push anything out the end. I was very paranoid about that, and picked. The time clock down here is accurate. This is now 53 minutes into it. So again, you can go back and fast forward and watch that other video. But I just wanted to show the level of bleeding on something where those terminuses, from the surgery site, these puppies were big. You can look at these trim cones that we're placing in. And one of the things because people still always ask about bleeding. I use 3% hypertonic saline. And so what I did is I just flooded those canals. I got it to where visually it stopped bleeding, flooded them, put the cones in, and then I'm going to take an x-ray. And then I just let it breathe. I let the body just breathe. Just let it go. Let it run its course, which is hard when you're in a procedure or you're getting timed and people are watching you. But the little pearl there is to do just that. Get up and leave the dang room. And figure out something else to do than watch the weeds grow in the mouth with the bleeding. And then I just fast forwarded to obturation. You see the technique. It was an injection technique. It was with BC Sealer. And then I just put the temporary in per the request of the referring doctor. And that's just kind of some very quick highlights. It's just showing you the procedure that we did as we took up. This procedure at this point, I'm a little over an hour, actually, 1 hour and 8 minutes, putting in the temporary from this pretty horrific retreatment. You ought to go watch the case because you're going to see me sweat. That's why. And then, with the temporaries, it's just temporary 101. I'm going to place a sponge and some temporary material, which is Colposol in my office. And so that's it. That's what we did. But the story's not over, is it? I mean, like I said, that video exists. It was an interesting history. But how did she respond? I mean, that takes guts. Like, presumably she's always had something wrong. It never was 100%. Like, she never really was happy. And she had all the strategies that we employ, from bite adjustments to antibiotics, and it tentatively worked. And just her focusing on other areas of the mouth, and maybe her general health had something to do with it. But she kind of just kept brushing things under the rug. And so I was pretty motivated to follow up, right? Because it's great. This technology is great. And anecdotally, when we work with it and we see it, that's great. But what are our patients really saying? So here we go. So you've been through a lot. Granted, some of it was you were asleep. But could you tell me, after we did the procedure, it was fairly long. By our standards today, that was a technique sensitive root canal. That's as hard as it gets in my book.
Okay.
So what was your recovery like after that procedure? Was it the same as before, or it took several months and some bite adjustments and all that? I mean, I didn't see you for any bite adjustments personally, but how was that? Was there a difference, in other words?
There was a huge difference. I didn't have hardly any pain. I think I took a pain pill that you had given me that day or that night, and it was more for my jaw than it was actually for the tooth itself. And after that, I never took anything else. It was completely pain-free within a day or so.
Okay, yeah. That's pretty impressive. And now we're looking at just right over, how many months are we?
It's
the date of the interview.
September.
Yeah.
So 6 months almost.
So we're about 6 months out.
Yeah.
Thanks for coming back.
You're welcome.
How was that? Any jaw pain, any other?
Nothing. Absolutely nothing. I forget I even had it done because I don't notice anything.
So, shoulda, coulda, woulda. What would you prefer? Just because you've been through it, every procedure an endodontist does, rank them for me.
I would definitely do the last one first. If I could do that and not have to go through everything else that I went through, because there was a lot of time, healing time, especially with the surgery and the numbness and feeling that weird sensation for a long time, and having pain, usually up to a week, having the root canals done before or more. I would do it this way every single time. I would never not have the GentleWave done.
So at this point, is it an influencer? If you needed another root canal, would you insist upon the GentleWave, or would you be just whatever the doctor says? Oh
no, I would insist on it because I can definitely tell there is a difference. I would definitely insist on it. I would go somewhere who's
so great. Probably every one of our pet peeves, and so 6 month recall. She's doing great. But did you notice that sponge was never, ever, ever replaced? So thank goodness at this recall, it was intact. She had great oral hygiene. She was very meticulous about it. I did ask her what the delay was, and she was like, she's like, well, candidly, it was two things. One, I was worried that it was going to be the same history as everything else I've gone through. It was a story of my life. But secondly, I forgot because it didn't hurt. And that was pretty remarkable for me when she said that. And that's actually what clued me into saying, hey, would you mind if I interview you? Could we do an interview process? I'll do that filling for free. And I got to take care of that. It's very important, and that's what we did. So from taking this 2D x-ray, did the filling, and then actually did a 3D scan that I want to show you. The 3D scan is just sort of to talk about where she's at and what the bone kind of looks like. I'm starting on kind of maybe the scar, but it shows you the retro plug that was in tooth number 30 as you look at where these crosshairs are. And that, there was something to there, and it wasn't bothering her. It likely was a non-issue. And then now we're focusing at 6 months at sort of this bone growth that's occurred around that sort of that mesial root of 31. And that's something to talk about. There may be still some formations, maybe there's still some scar formations that are exchanging as the ossification process occurs. But it does create from the original an appearance of bone presentation that wasn't there before. But more importantly it was the absolute stability that she had in chewing. She still needs implant work on the other side that has not been done from that Saga. So she's very happy that this side now is sound and in functioning, because now she's got the courage to go back and fix the rest of her mouth. And the patience of this woman is second to none for everything that she's been through. But still scanning through this just to give you a few other looks. And all things considering this story, like I showed you, like the dates were a little bit off when you read the record. It was from 1998 until present date was honestly the first time she could function. And that's the testament of what we do. Like, at the end of the day, it's what our patients say that matters most. And getting back to form and function, to preserve the natural dentition, which is what her request was. I had no idea if this was going to work. I had no idea what I was opening the can of worms to. Like I said, I was really stressed during this case, in all honesty. My goodness, I wasn't expected to see thermophil carriers that had been resected. So when that root resection occurred, and I was just worried about those thermophils coming out. And so I'm very glad to report that this stressful case actually has a happy ending, and so far so good. So only 6 months, we'll see how it goes, and then I encouraged her to go off to get the other side of her mouth restored. So I hope you guys find this interesting, and promise me you'll go back and look at the technique and look at the procedure that we did on that second episode. Hindsight's always 20/20. I've watched it and I thought 1,000 things I could do different next time, but all in all, we achieved success. And you know what? The BC sort of sealer poof was still present. That hadn't washed away. And there wasn't, a ton of extrusion for what you would think would have been. And I kind of argued that there was this chronic, long-standing, 98 till present tense lesion that was sort of disrupting the patient's lifestyle, that I was sort of working into that environment during that retreatment. And now, c'est la vie, like she's happy. So hopefully you find this interesting. Don't forget to subscribe. Until the next time, we have another video coming up right before Halloween, so we'll find something gory for you guys to look at for that case. But thank you so much. See you later.